Hi everyone, I just thought I'd give a little reintroduction to myself, my business, how I work. My name's Zara. I'm a pelvic health physio based on the Gold Coast. I also do telehealth, so I can reach people all throughout Australia. I graduated physio, tried to do like a general muskies practice thing and freaked out. So went overseas and got a women's health position in London as a locum, and that's where I fell in love with speaking, particularly with women. And it was there that I came back to Australia, and I just was so motivated to get work in women's health. So I was in the hospital for a long time and got some wonderful opportunities where I got to work with diverse population groups and pregnancy, postnatal, but also with really challenging birth stories as well. And within pelvic health clinic with people with bladder, bowel, prolapse, sexual pain, and really complex pelvic pain. I then had my children and changed. I had a little bit of a just life needs to change moment. I absolutely adored my work and how I got to connect with people in the hospital, but I needed to do more. So an opportunity came up where my husband was building a workspace, and when they were designing it, they popped a little room behind the reception, and we sort of planted the seed then that would be a space that I would use. And then the building completed, so he was like, all right, you jumping in, or what's going on? So yeah, that's how I jumped into private practice, and I've been working for myself in my own way over the last 2.5 years or 2 years. The way I work is that I really honor my work, and I really honor the people who I work with, and that's how I want to live my life, and that's how I want to represent myself in my career and how I connect. I feel teary just talking about it. So I do long consults with everyone. Sometimes I might do a short consult, but I reckon I've done less than, so in 2 years, I've probably done less than a dozen short consults. So my consults are a full hour with everyone. I work with empowering people within themselves. So they come to me for the help, for the guidance, to fill the gaps, to understand, to come back to self-love. But then it's really about me showing them how they can help themselves, and how they can keep moving forward, and how they can move back into the things that they love to do and connect back with themselves. That's a really big part of what I do. So yeah, my consults are quite detailed, but it's all about setting up a plan that's really going to work for you in your life, and really is going to make impact. And my clinical space is quite representative of what I enjoy to do in life, which is I'm really connected to, or really love being outside and in nature. So I've got a space that really reflects that, and that brings so much joy. And I think it really helps to make people feel really safe and loved and cared for, and just all of those beautiful things that we want people to come back to when particularly if they've been in pain for a really long time. I also have a bit of a analytical, woolly, Virgo-y, perfectionism-y, but I love research. So I really enjoy also challenging models of care and how we actually work. And I think that's where in private now I can keep looking at how I'm doing things, but be like, oh, how can I do things differently? And I have flexibility as well with my family, because I have at 2026, I've got a 4-year-old and a 4-year-old boy and a 6-year-old girl, and they are my life. So for me as well, it's about being able to work in a way that I can also be present with them. So yeah, hopefully that gives you a bit of insight.